some documentary, and it was, and you know, in male rats and mice, and
we're in the Arthur Guyton Research Complex at the University of Mississippi Medical Center. This is one of the newest buildings on campus, and what you see here is lab space on floors 6 and 7. We're on 7 right now. The top 2 floors are being finished out and it's nearly complete. You can see the lab space. And these top 2 floors are going to be for the Cancer Institute, and this is all going to be research space. We expect these to be completed and open sometime this summer. Filtered, disposed.
This is a wonderful institution that has a great track record in a number of fields, particularly physiology and cardiovascular research, and now we're building in other areas, including cancer. We have been able to recruit a number of scientists and physicians over the last few years that are outstanding, and we're continuing to recruit and expand the program. And the goal is to have a cancer program here that's on par with the best in the nation. There are a few dozen NCI-designated cancer centers across the nation. The state of Mississippi does not have any other medical school or academic health center, and so it was absolutely indispensable for UMHC and UMMC to have a cancer institute. Chancellor Jones, when he was the vice chancellor, determined that there was a need to start a cancer institute at UMMC, and Dr. Files was the first director. The institute started in 2004. And when Dr. Files had laid the foundations, the university started recruiting for an outside candidate to lead the next phase of the building of the institute, and this was the time when I eventually joined. In an academic institution, cancer care is done in a highly specialized fashion. Patients are seen by a group of specialists, all of whom work exclusively on 1 or 2 types of cancer. These specialists meet all together in a multidisciplinary group, and they all evaluate the patient and they all decide on treatment. The idea that cancer can be treated by a single doctor belongs in the past. Nobody knows enough to treat one cancer with just one type of specialty training. At all premier institutions in the country, cancer treatment is a multidisciplinary team process in which surgeons, medical oncologists, radiation oncologists, pathologists, radiologists, behavioral specialists like psychologists, geneticists, all interact, plastic surgeons, and work together in generating the best treatment plan. For example, we have in our breast and colorectal cancer programs, we have the ability to generate a cancer genetics consult for a patient immediately, because the geneticist is part of the team, and to screen people for mutations that may predispose them to certain cancers. There isn't anyone else in the state that has the ability to do that.
It's important that the University of Mississippi Medical Center have this kind of lab space, have Class A lab space for research, because obviously research is about finding the cures for diseases, about understanding the diseases, and secondly, it's important because research is essentially economic development. If we can bring in scientists These are highly trained people who often bring in lab assistants, and they might bring in postdoctoral researchers with them that they're training. It's sort of reverse brain drain. You're bringing talent and funded scientists into Mississippi who are going to be getting federal grants, bringing new money into the state.